Hey there, YouTube family. My name is James, and I wanted to welcome you to the Everything Healthcare channel. During my time in the healthcare industry, I've noticed that there is often a lot of neglect when it comes to the topics of hospice and palliative care. Many people have the wrong idea about what hospice entails, and others have never even heard about palliative care to begin with. In this video, I'm going to talk about both topics and also explain their similarities and differences. One important thing to note is that both hospice and palliative are often covered by Medicare, Medicaid, and several private insurance plans. You would have to check with your insurance company to verify, but this can lift a lot of the financial burden from already stressed out family members. Without further ado, let's start with hospice. So what is hospice care? Hospice is a specialized form of medical care that focuses on providing comfort and support to people who are in the final stages of a terminal illness. The goal of hospice care is to manage pain, reduce symptoms, and improve the quality of life for the patient and for their loved ones. Hospice care is available specifically to individuals who have been diagnosed with a terminal illness and have a life expectancy of 6 months or less. Patients who receive hospice care have made the decision to stop curative treatments and focus on comfort care. Now you might be wondering, what services are included in hospice care? Well, hospice is provided by a team of healthcare professionals who work together to provide care that addresses the physical, emotional, and spiritual needs of the patient and their family. The team may include doctors, nurses, social workers, chaplains, and other professionals. The services provided by hospice teams include pain and symptom management, medication management, emotional and spiritual support, respite care for caregivers, and bereavement support for families. Hospice care is typically provided in the patient's home, but it can also be provided in a hospice facility, hospital, or nursing home. The hospice team works closely with the patient's primary care physician to develop a care plan that meets the patient's unique needs. The hospice team is available 24/7 to provide support and care to the patient and their family. The team also provides education and training to the patient's family and caregivers to help them provide care at home. At the end of the day, hospice care is important because it provides a compassionate and supportive environment for patients and their families during a difficult time. It allows patients to focus on quality of life rather than curative treatments that may cause discomfort or pain. If you or a loved one is facing a terminal illness, consider hospice as an option for end-of-life care. Talk to your primary care physician or a hospice provider to learn more about the services that are available to you. Now that we know more about hospice and what it offers, let's learn a little bit more about this mysterious topic of palliative care. Palliative is a specialized form of medical care that focuses on improving the quality of life for people who are living with a serious illness, such as cancer, for example. And the goal of palliative care is to provide relief from the symptoms and the stress of the illness, and to support the physical, emotional, and spiritual well-being of the patient and their family. Palliative care can be provided at any stage of a serious illness. Patients may receive palliative care alongside curative treatments, and the focus of care is on improving quality of life rather than prolonging life. Palliative care is provided by a team of healthcare professionals who work together to provide comprehensive care that addresses the patient's unique needs. The team may include doctors, nurses, social workers, chaplains, and other professionals. The services provided by palliative care may include pain and symptom management, emotional and spiritual support, counseling, assistance with advanced care planning, and coordination of care with the patient's primary care physician and other specialists. Palliative care can be provided in a variety of settings, including hospitals, nursing homes, and the patient's home. The goal is to provide care that is tailored to the patient's individual needs and preferences. While hospice care and palliative care share some similarities, there are also some important differences between the two. One of the main differences between hospice care and palliative care is the focus of the care. Hospice care is typically provided to patients who have a life expectancy of 6 months or less and who have made the decision to stop curative treatments. The focus of hospice care is on managing pain and other symptoms and on providing comfort and support to the patient and their family during the end-of-life process. On the other hand, palliative care can be provided at any stage of a serious illness, and patients may receive palliative care alongside curative treatments, such as chemo or radiation. Another difference between hospice care and palliative care is the duration of care. Hospice care is usually provided in the last 6 months of a patient's life, while palliative care may be provided for a much longer period of time, depending on the patient's needs. In terms of services provided, hospice care and palliative care share many similarities. Both types of care tend to include things like pain and symptom management, as well as emotional and spiritual support. However, hospice care may also include services such as respite care for caregivers and bereavement support for families. Thanks for sticking around to this point in the video. I hope you learned something new today. It would mean the world to me if you could hit that subscribe button so we can continue to grow together as a channel. Your support allows me to keep making videos just like this one. Also, smash the like button if you enjoyed the content. I have something new for you every week, so stay tuned and see you next time.